Hey everybody, and welcome back. In today's video, we're going to be discussing CNA and PCT, the clinical skills practice test questions. That's what we're going to be reviewing today. And as we do in each of our videos, we'll give you about 10 seconds to receive your notifications and we will get started. So hello everybody. I won't be monitoring the chat until the end, but I do want to tell you that on the majority of the slides, there's going to be a QR code. And so what you do is you open up your camera app on your phone, point it towards the QR code, and then click the link, and it's going to take you to the skills or the training video associated with the question on the video. So that's going to help you not just learn knowledge, but reinforce it and understand the skills better. So let's go ahead and get started, and thank you for joining. All right, so let's build your confidence, team. Before you begin, let's find a quiet space for you to focus. Have a notebook and some scratch paper available, your pen, your pencil. Read each question carefully and then trust your instincts. You already have the heart for patient care, and a lot of questions that we receive is related to the location. Are our questions good for California, for Ohio, for New York? Of course, you all. This is based off of national standards, unless I specifically say Florida. This is how you're going to be able to perform this skill regardless of your location. But when in doubt, you have your own instructors at your own schools. You can always reach out to them for guidance. As a reminder, how to use the QR codes, not during this live segment, but when you go back and you replay, pause the video when you see a QR code on the screen, open your camera app on your smartphone. Some of you all may have to actually download a QR reader app. They are free. Once you have your app open, you would point your camera towards the QR code, and then you would tap the link that appears on the screen, and that's going to take you to the website, or the YouTube video link, so you can learn more about the skill. Question 1. Which action should a CNA take before helping a patient ambulate with a gait belt? Is it A, ensure the patient is wearing non-skid footwear, B, ask the resident to stand up alone, C, apply gloves, or D, lower the bed to the floor? And this is Saturday, so it's going to be fast paced. If you need to slow it down, click your widget and then change the playback speed. But we're revealing this answer in 3, 2, and if you chose A, you are correct because safety is the priority. Therefore, non-skid footwear must be put on your patients, whether it's the socks with the little lines on the bottom or it's actual shoes. Non-skid footwear helps to prevent falls during ambulation or walking. And again, if you want to watch the video, open up your camera app, point it towards the QR code, and then click the link that appears on your screen. Question 2, a patient is incontinent and requires perineal care. The way I think of perineal care is whatever's in the diaper region, if the patient would have on an incontinent brief or if they were wetting themselves. So a patient is incontinent and requires perineal care. What is the proper step during cleaning? Is it A, wipe back to front, B, wipe front to back, C, wipe in a circular motion around the perineum, or D, dry the area before cleaning? And this should be an easy one for my scholars, for my CNAs, and my future nurses. So it is B as in boy. Wiping from front to back helps to prevent the spread of bacteria from the rectum to the urethra. Thus, it reduces the risk of infection. So we're always cleaning from the cleanest area towards the dirtiest. So that's why we wipe from front to back. And if you want to watch the video, click the go ahead and access the QR code that's on the screen. Question 3, which of the following is appropriate when assisting with feeding a patient with dysphagia? Is it A, encourage fast swallowing to finish meals quickly, B, offer water after each bite, C, use a spoon to offer small amounts at a time, or D, tilt the patient's head backward to help with swallowing? Oh, what do you think, team? What do you think? And I know the questions are tricky. They're supposed to be tricky. Otherwise, it wouldn't be a test. All right. And so for question 3, the answer is C. And so you're going to use a spoon to offer small amounts at a time because small bites reduce choking risk in patients with swallowing difficulty. And we usually don't have them tilt their head back. We have them do chin to chest. So their chin or their neck would actually be forward, not backwards. And we have a video on that skill also. Question 4, how should a CNA measure a patient's height in bed if they cannot stand? A, use a tape measure from head to toe. B, use the height on the patient's ID bracelet. C, ask the patient to guess. Or D, use the height listed in the chart. And I do see some correct answers coming through. I'll give you about 4 more seconds. So 4, 3, 2, and yes, it is A. Make sure the bed is as flat as possible. The reason why I say as flat as possible is because if your patient has respiratory issues, you may not be able to lay the bed totally flat. But in a perfect world, you would lay your patient flat, remove the pillow, and measure them from head to toe. Measuring directly ensures accuracy when a patient is non-ambulatory, meaning that they're bed bound and or they can't get out of bed and walk. Question 5, when turning a patient with a weak left side, which side should the CNA roll the patient onto? Would it be A, the back, B, the right side, C, the left side, or D, stomach right side? I have no idea what that is. It sounds like the Sims position. All right. And so, yeah, thank you for understanding. All right. So question 5, if a person has a weak side, we will try to the best of our ability, not roll them too often on their weak side because they won't feel the pressure. They won't be able to tell you if they have pain on that weak side. So one of your best options would be to turn them on the opposite side, their stronger side. And they're not all the way on their side. They're just kind of tilted a little, and you'll use pillows to help keep them positioned. So always turn the patient on the stronger side for better comfort and control. But it would be pretty much, I like to have them on their back during meal times. And we're not going to talk about the position they're supposed to be in during meal times because that will give you an answer to a future question. But back during meal times, maybe the left side after their meal, and then back to the back, and then their right side. And so pretty much every time they're going to be eating, they're back on their back in either the Fowlers, semi-Fowlers, high Fowlers, one of those types of positions. I won't give you the answer right now, but hopefully that helps you, understand how we rotate our patients every 2 hours. That way they're not staying on one side for too long. And if you want to see our video on how to feed a CNA, just go ahead and access that QR code. All right, so question 6, I said how to feed a CNA, how to feed a patient, but yeah, you all need to be fed too. Question 6, before taking a manual blood pressure, the CNA should do which of the following? Is it A, inflate the cuff to 300 millimeters of mercury? B, elevate the patient's arm above the heart? C, ask the patient to hold their breath? Or D, ensure the arm is at heart level and relaxed? A manual blood pressure. You're using a sphygmomanometer. So let's say that word together, sphygmomanometer. So what we usually just call it is the blood pressure cuff. But if you're taking a manual, an old-fashioned way, the old-fashioned way with a stethoscope of doing the blood pressure, of course it needs to be D. You need to ensure the arm is at the heart level and relaxed because proper arm positioning is critical for accurate readings. And you'd also do the same with an automated blood pressure cuff. But regardless, in order for you to do a manual blood pressure, you have to know how to read the gauge. And so we have a video on that. That's part 1. And then you would just go to the next video, part 2, that shows you how to actually perform a manual blood pressure. Question 7, which is the correct action when performing oral care on an unconscious patient? Is it A, use mouthwash with alcohol, B, use a tongue depressor to keep the mouth open. C, position the patient on their side. Or D, suction only if the patient coughs. All right, so you have an unconscious patient. You have to perform oral care. More than likely, they don't have a gag reflex. And so you got to be very careful when you're putting, fluid or the oral swab in their mouth with a little bit of mouthwash on it, because even the tiniest bit of the fluid can actually enter their airway and they can't cough it up. So anytime you have an unconscious patient, you're going to turn them to their side. The answer is C. The sideline position prevents the risk of aspiration of fluids. Question 8. What is the first step in using a mechanical lift? Is it A, lower the patient onto a sling, B, check the weight capacity, C, plug in the lift, or D, unlock the wheels? The first step, you're using a mechanical lift. Yes, you have it, you all. It is B, check the weight capacity. Verifying the lift can handle the patient's weight ensures safety. Number 9, and if I didn't tell you, we're going all the way to question 50. Number 9, when measuring urinary output from a Foley catheter bag, and I hate saying the word Foley because not every catheter bag is made by the brand Foley, but it's just become such a common term as if it's universal and that's the only type of drainage bag. So let me stop. All right, so when measuring urinary output from a urinary drainage bag, the CNA should A, pour into a graduated container for measurement, B, empty it directly into the toilet, C, guess the amount, or D, document the amount as 500 ml if the bag is full. I know you got it. You can do it. All right, looks like we're torn. I see a couple of answers coming through, revealing a response in 3, 2, and it is B. So you want to pour it into the graduated container for measurement. It would not be D because most of the drainage bags can hold up to 1,000 ml or 1,000 cc's, depending on where you're taking your test or what your facility's protocols are. In Florida, whenever it's pertaining to urine output for the CNA test, you cannot use milliliters, mLs. You have to use cc's, which stands for cubic centimeters. And so if you click the QR code that's on the screen, you will see me demonstrating that skill on how to empty and measure the output from a urinary drainage bag, aka a Foley bag. Question 10, when making an occupied bed, which action helps prevent cross-contamination? A, ask the patient to get out of the bed. B, roll the patient completely to one side of the bed. C, replace both sides of the sheet at the same time. D, place or roll the clean sheet near the dirty one without letting them touch. So your key term is cross-contamination. How do we prevent one object from contaminating the other? And that is right. If you chose D, ding, 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 ding. Yes, you're right. So you're going to place or roll the clean sheet near the dirty one without letting them touch. And I do have a video on this skill. You just have to do a search on our channel on how to make an occupied bed. But the rationale is to reduce the risk of spreading germs. The clean linen should never come into direct contact with the dirty linen. So if you really have to, you can put a towel in between the two. And that way your clean sheet touches the clean towel instead of getting contaminated with whatever is on the dirty sheet, the one that you're removing. So watch our video so you can, kind of get a visualization on that. So when changing sheets on an occupied bed, caregivers roll the soiled sheet inward and tuck the sheet underneath it, being careful to prevent it from touching. The only way that I can usually, make that happen is if I use a towel. This practice maintains proper infection control. The other options may be either impractical because you can't take the patient out the bed if they're bed bound and you have to change an occupied bed. Taking them out the bed sometimes takes too long, and getting a Hoyer lift, that's a whole nother skill set. So the other options may be impractical, unsafe, or not directly related to preventing contamination. Remember, the question was about preventing cross contamination. Number 11, a CNA notices that the oxygen tubing has become disconnected from the wall. What should the CNA do first? A, turn off the oxygen tank. B, reconnect the tubing to the wall oxygen outlet. C, notify the nurse. Or D, raise the head of the bed. Yes, team. Yes, yes, yes. Yes, you're going to reconnect it. So, no, you cannot adjust the flow, but you can reconnect the tubing. Calling the nurse in. The nurse sometimes can take 5 to 10 minutes to get there if it's not an emergency. So are you really going to let your patient go without oxygen for 5 to 10 minutes? You will reconnect it and then monitor the patient, make sure they're okay. If they're not okay, get your nurse in the room. But usually that will resolve whatever issue, and they can tell you, it's like, hey, I don't feel any air flowing. And when you trace your tubing, when you trace your nasal cannula, you're going to see that maybe it has come loose. And so you can reconnect that. Question 12, when preparing to transfer a patient from bed to wheelchair, which step should come first? Is it A, lock the bed wheels, B, apply the gait belt, C, ask the patient to stand, or D, position the wheelchair? All right, let's see what the answers are. Yes, locking the brakes, period. Whether it is on the bed, the wheelchair, the brakes have to be locked. So once you get that wheelchair position, that's when you can lock the brakes. But make sure when you go into your rooms that the brakes on the bed are also locked. A lot of your newer beds, they alarm or they flash if and when the brakes are unlocked. So that, kind of help you out. But if you don't have a newer bed, if you're in a nursing home or in home care and the bed is on wheels, just go ahead and do a safety check. Try to, make sure the brakes are locked on all four wheels before you attempt your transfer. And then make sure the brakes are also locked on the wheelchair. Locking wheels prevents movement during transfer, thus reducing falls. Question 13. When assisting a patient with one-sided weakness to dress, the CNA should A, dress the strong side first, B, dress the weak side first, C, let the patient choose which side to start, or D, remove clothes from both arms at the same time. All right, and so revealing the response in 3, 2, and we start off with dressing the weak arm first. The weak arm needs more support, so you can hold it, you can put the sleeve on, and now once that weak arm is dressed, that person can usually help you. They can reach back, they can stretch forward with their strong arm. So dressing the weak side first makes the process easier and less painful for the patient. So when you're starting off with the weak arm, don't forget, you're to support, you're to assist, you're to get, everything in place, and then the patient can help you with their stronger side. And we have a video that covers that skill also. Question 14, after shaving a male with a disposable razor, what should the CNA do next? A, reuse the razor for the next patient. B, leave the razor on the sink for disposal later. C, throw the razor in the trash can. Or D, place the razor in the sharps container. Remember, they're not at home. They're in a facility. They're in a nursing home or a hospital. What's going to be safest, not just for the patient, but for the visitors, the other people who are coming in and out of the room, or maybe they have a roommate. And so the answer is D. That's right. Single use. Once they've used that razor, you're going to place it in a sharps container. It must be disposed of properly to prevent injury and or infection. 15. A CNA is assigned to collect a stool specimen. What should they do first? A. Place the sample in a sterile cup. B. Label the specimen container. C. Give the patient a bedpan or use a collection device. Or D. Store the sample in the fridge. I know, this one's a little bit tricky. It's tricky for them. It's not tricky for Nurse Eunice's CNA students because you all have the right answer. Yes. How are we going to collect it if we don't have anything for the fecal matter to actually be put into? And so it's going to be C. You're going to give the patient a bedpan if they're not able to get up. But if they are able to get up, whether it's to a bedside commode or an actual toilet or commode, that upside down head, that collection device, you're going to put that in the toilet towards the back of the toilet so that you can collect the stool specimen. So the first step in collecting a stool specimen is to obtain the sample correctly. This means the CNA must provide the patient with a clean, appropriate collection device, such as a bedpan or a collection hat. Once the stool is collected, the CNA can then place it in a specimen container, label it, and store it properly if needed. Labeling and storing come after the sample is collected and not before. And yes, we have a video on that too. All right, so question 16. What is the most effective way for a CNA to prevent the spread of infection? Is it A, practice proper hand hygiene regularly? B, wipe down surfaces once a day? C, wear gloves at all time? Or D, keep all patients in isolation? Easy peasy. It is A. Hand hygiene is the number one method of preventing the spread of infection. And you can watch me performing hand hygiene, hand washing for the CNA test by clicking, by using your camera app, and then going ahead and clicking the link that appears whenever you scan the QR code. Question 17. When providing catheter care to a patient with an indwelling catheter, what area should the CNA clean? Is it A, only the catheter tubing, B, from the insertion site outward, C, around the catheter only, or D, from the drainage bag upward? So your patient has an indwelling urinary catheter. What are you cleaning? And that's right, it's from the insertion site outward. So it's going to be B. Clean it from the insertion site away from the body, reduces the chance of pushing bacteria into the urethra. So you're going to secure your catheter and then wipe away. And on one of the following slides, you'll see the QR code so that you can watch our video on catheter care. Question 18. What is the correct position to place a patient in if they are What is the correct position to place a patient in for eating if they are in bed? Is it A, supine, B, side lying, C, semi-Fowlers, or D, high Fowlers? I know, it's like, which one do you do? Which one do you do? Oh, if you're going to make an error that's directed toward the safest way to feed somebody. So when you're feeding somebody, yeah, we want them to be comfortable. But what happens is if you start off feeding them in the semi-Fowler's position with them relaxed back, and then they start coughing, which is a sign of aspiration, that's when you want to try to sit them forward. So what I do is I just alleviate semi-Fowlers. If food or water is going in your mouth, you're going to do D. You're going to have them upright the way we are in our chairs, 90-degree angle. You're going to sit them upright because it promotes safe swallowing and it helps to prevent aspiration. Question 19. How should a CNA respond if a patient begins to fall while being assisted to the bathroom? Is it A, grab the patient tightly and lift them? B, try to keep the patient standing? C, ease the patient to the floor and protect the head? D, run to get help. While the patient's falling, you run to get help. So we absolutely know it's not D. I Better not see you running while a patient's falling. And so the answer would be C. You're going to ease the patient to the floor and protect their head. CNAs are taught to guide patients who are falling safely to the floor to prevent injury. And we do have a CNA practice test that covers fall precautions. I have not yet created a video on what to do if a patient falls. And so I need some thumbs up. I need some likes. If you all want me to create that video, my team and I, we can do so. But you are to try to ease them to the ground. You're screening out for help. And then once you have them on the floor, protect their head. If they're already dizzy and you just leave them sitting up, they can fall forward, they can fall to the side, so it can cause a head injury. So make sure you protect their head once you have them on the floor. Question 20. What is the purpose of turning and repositioning a patient every 2 hours? Is it A, to reduce the risk of incontinence, B, to reduce the risk of aspiration, C, to reduce the risk of depression, or D, to reduce the risk of pressure ulcers? Why are we turning and repositioning every 2 hours? Why do you have to document that? That's right. It is D, because we need to document that we're supposed to be doing, and we actually did it. Don't just falsely document, because otherwise, if they stay in a position too long, it can increase the pressure, which could cause a skin injury, which could develop into an ulceration. So regular repositioning promotes circulation and prevents skin breakdown in immobile patients. And we do have a skills video that talks about pressure ulcer prevention and also how to do a skin assessment while you are giving your patients a bath. 21. What is the correct method for removing soiled gloves? Is it A, pull from the fingers of both gloves at the same time? B, peel one glove off and hold it in the gloved hand while removing the second? C, use your teeth to pull the glove off? Or D, pull both gloves off quickly and throw them into the trash? You all are awesome. You all are amazing. The answer to 21 is B. Peel off one glove and hold it in the gloved hand while removing the second. This technique ensures contaminated surfaces are not touched, reducing cross-contamination. And I just created a video on that one yesterday. And so if you want to see me being goofy and happy inside of our office, practicing skills, go and watch our video on donning, which means putting on, and doffing, which means taking off gloves, but that term is used universally. Those terms are used for PPE. So you can don and doff gloves, mask, etc. So just think don, D-O-N, the O-N, you put something on, and the doff, D-O-F-F, off, you're taking your PPE off. Question 22. A patient in contact isolation needs assistance. What PPE should the CNA wear before entering the room? Is it A, gloves only, B, mask only, C, gloves and gown, or D, gloves, gown, and a face shield? Patients on contact isolation, what are you going to put on before you enter the room? Yes, C is correct. So contact precautions require gloves and gown to prevent transmission through direct and indirect contact. 23. A CNA is assigned to care for a patient under airborne precautions. Which of the following PPE is required? Is it A, a face shield with mask, B, gown and gloves, C, surgical mask, or D, N95 respirator? Get your pen and papers. I know this one's hard to remember. Airborne precautions. What PPE do you apply? Oh, we're torn. I'll give you about 5 seconds on this one. You have it. The correct response is D, an N95 respirator. That mask is essential for protection against airborne pathogens like TB or tuberculosis or varicella. And so what's going to happen is your facility will fit test you so that you'll know what size N95 respirator mask that you need whenever you're taking care of a patient on airborne precautions. 24. What should a CNA do before entering a room for a patient on neutropenic precautions? Is it A, put on a mask, gloves, and gown? B, wash hands and ensure no signs of illness? C, put on gloves and gown? Or D, double glove? And after you put your answer in the chat, let me know, what do we mean by neutropenic precautions? I need for you all to know this terminology. I have some videos that are coming out. We're going to redo the terminology video with the images to help you understand the concepts. But yeah, now we have about 100 questions. So the video may take a little bit of time for us to create because we have to make sure we have the right images, but I'll let you know when that's going to be posted. And if you want to know when we're posting our videos, make sure you have subscribed, that you've turned your notifications on, because we don't have a consistent schedule. We actually run a full training facility in Jacksonville, Florida. So we have in-person students, and then we also have you all, and we thank you all for watching. The answer to 24 is B. Before you go into a patient's room who's on neutropenic precautions, you need to make sure that you should even be in that room. The answer is going to be B. Wash your hands and ensure that you have no signs of illness, because neutropenic patients have weakened immune systems, and caregivers must be healthy and practice strict hand hygiene to prevent infection. So if you have a cough, if you have the sniffles, if you know that you're just getting over something, that's not the patient you should be assigned to. You want to be telling your nurse, what's going on with you, so they can give you a different patient, because we cannot afford to take our germs into that patient and they get sick. 25. When caring for a patient on droplet precautions, which PPE must the CNA wear? So droplet is different from airborne. Droplet, they sneezed, it dropped on the table. Airborne, they sneeze and it stays in the air. All right, so if someone's on droplet precautions, should you wear A, gown and gloves, B, a surgical mask, C, an N95 respirator, or D, shoe covers? Now, is it B? Is it C? Revealing the correct response in 3, 2, and it is B. So droplet precautions are for conditions such as the flu or COVID. You can wear a regular surgical mask or a face mask to prevent inhalation of large particle droplets. Question 26. A CNA must reposition a patient with a stage 1 pressure injury. What is the best action? Is it A, leave the patient on the same side for comfort? B, apply lotion to the open wound? C, massage the area? Or D, reposition and offload pressure? A stage 1 pressure injury. All right. Yes, it is D. So you're going to reposition and offload the pressure. Removing pressure allows blood flow and healing to begin in early pressure injuries. So if you notice, while we have this patient's legs elevated, the heels are free floating. They are in the air. The pillow is not touching the heel, because a stage 1 in your textbooks is going to say a sign of a stage 1 pressure ulcer is redness. African American and darker skinned populations, we don't necessarily turn red. So a term that I want you to kind of become familiar with is discoloration, or it could be tender on their heel. That could be a sign of a stage 1 pressure ulcer. Again, some populations will not turn red. As a CNA, you have to be able to care for patients across cultures and understand that even though some of the terminology in your book, it may say redness, some of your patients won't turn red. So offload them regardless. 27, a CNA is instructed to assist with passive range of motion, ROM exercise. What does this mean? A, the patient performs the exercises alone. B, the CNA guides the movements without the patient assisting. C, the patient walks in the hallway. D, the patient stretches using exercise bands. What is passive range of motion? Yes, you are right. It is B. So, whenever we're talking about passive range of motion, that means that the patient really isn't able to assist you much. They just are recovering from a recent surgery. So, you have to provide most of the support. Active range of motion is when you would tell me as the patient, Miss Eunice, would you raise your arm up and down 3 times? And if I can do it without your assistance, that will be active. But if you're supporting like you have to do on your CNA test and you have to provide the range of motion exercises, that would be passive. And don't forget your ROM exercises are done to maintain joint flexibility in immobile or injured patients. 28. A patient is at high risk of falling. Which action by the CNA helps reduce fall risk? Is it A, keep all 4 side rails up at all times? B, turn off the bed alarm to avoid disturbing the patient? C, keep the call light and personal items within reach? Or D, encourage the patient to get up alone to promote independence? All right, and if you've been here this long and you haven't liked our video, go ahead, give us a thumbs up, subscribe, because we're doing great things in 2025. We have a lot going on, and we're here to help you earn your CNA licenses, pass your nursing exam, to open up your businesses, to learn CPR. I just love how you all have connected with us, and how we, just really try to make sure that you can pass your test, because we need great caregivers like you. And so 28, the answer is C. You want to prevent falls, give them everything they need, keep it all within reach. Make sure that call bell's within reach. That way, if they need to call for assistance, they can. So ensuring access to needed items can prevent unsafe movements that lead to falls. 29, a patient with C. diff is in isolation. Which action by the CNA is essential when leaving the room? A, use alcohol-based hand sanitizer. C, only remove gloves. B, only remove gloves. C, place the mask in a red biohazard bag. Or D, wash hands with soap and water. Yeah, can't trick you all. Oh, you're so awesome. So anytime a patient has C. diff, they have that very foul smelling diarrhea, a lot of stool. Yep, you're going to collect that stool specimen, and you're going to notice it first, because you're in the room with the patient. It's like, hey, Nurse Eunice, this patient's stool just has a really foul smell, and it's watery, and it's a lot of it. And I'll be like, did you save some? Because then I'll call the doctor to get an order for the specimen. So sometimes we as a team will know what's needed, and we have to alert the doctor in order to get the order. And so I need for you from that point on, we have to go ahead and put that patient on isolation. Of course, I'll call the doctor to get the order. But if we think they have C. diff, you cannot use hand sanitizer. Because C. diff is a spore. It's hard to kill. The sanitizer cannot penetrate that spore. Instead, we have to wash hands thoroughly with warm water and soap, and the actual friction will remove the spores off of your hand and your skin and wash it down the drain. So again, C. diff spores are not killed by sanitizer. Therefore, soap and water must physically be used to remove the spores from your hands. 30. There is a small fire in the kitchen area of a long-term care facility with multiple bed-bound patients. What is the best action for the CNA to take first? Is it A, try to extinguish the fire? B, close all fire doors to contain the fire? C, begin evacuating the entire building? Or D, wait for the fire department to arrive? And I included this question because there was a recent fire at a nursing home, and allegedly, I've not followed it too closely. Allegedly, the caregivers left the patients, the residents, and nearly 10 of them lost their lives at the time that I heard of the story. It could be more, and some of them were in critical condition. So if there is a small fire in a kitchen area of your facility, you're not going to evacuate because it's hard to evacuate 70 bed-bound people. What you're going to do is you're going to do B. You're going to close all the fire doors to contain the fire. Usually the doors have a fire rating. It can hold off the fire for an hour, for 2 hours. So in a facility with vulnerable bed-bound patients, the priority is to contain the fire and to protect the patients or the residents from smoke and flames while ensuring safe evacuation can occur if needed. Closing fire doors is part of the RACE protocol that refers to your priorities during a fire emergency. The R in RACE stands for rescue. The A stands for alarm. So if you usually have fire alarms, if the fire alarms are not working, you're going to physically pick up the phone and call the fire department, call 911. The C in contain is that when you're closing off those doors, you're closing off the doors in the hall, you're closing off the doors to the individual rooms. And then E would be extinguish. And when we can extinguish the fire, the other word we use for E would be evacuate. And so, but if you hopefully use the RACE protocol, that's going to prevent the fire from spreading and it's going to help save lives. 31. A CNA is assigned to care for a patient who needs frequent assistance. Which action is the best example of clustering care? A, take vital signs now and returning later to help with repositioning. B, assisting with toileting now and returning later for oral care and a linen change. C, giving a bed bath and oral care during the same visit before breakfast. Or D, giving a bath in the morning and brushing teeth after lunch. All right. If you find yourself just ripping and running, not being organized, a term that I need you to research is cluster care, because the correct response would be C. Clustering care means you're completing several tasks in one visit to reduce unnecessary patient interruptions, promote rest, and to improve time management. So do as much as you can for that one patient while you're in the room with them. And that's going to help, conserve your time, your energy. And plus, some of these patients, they don't want to be bothered like that. They're tired of you coming in their room every hour. You already got to check on them when they're sleeping, but to just keep, bothering somebody every hour because you're not organized, that's not the most efficient way to provide care. 32. Which action best prepares a CNA for shift report at the start of the day? A, arrive late to avoid standing around. B, bring a notebook and pen to write down key information. C, skip report and read the chart later. D, ask another CNA to summarize it for you later. All right. And so as a good CNA, you're going to get there early. Plus, if you don't get there early, you don't get a Dynamap, you don't get your blood pressure machine, you don't get your linen. So yeah, you need to get there early. And then you're also going to do B, going to bring something so you can write down vital information. You're going to take notes. So taking notes during a report helps you remember patient conditions, changes, and duties. 33. What should a CNA do during hourly rounding? A, check the patient and leave immediately. B, only assist patients who have called. C, turn off the lights and leave the room. D, ask if the patient needs to use the restroom, if they need repositioning, or if they need, pain relief. And when you think of pain relief as a CNA, you don't give medications, but you can do non-pharmacological things such as elevation. If they have an order for an ice, a cold compress, or a warm compress, you can do things like that. And you can also notify the nurse. So with that being said, we all know the answer to 33 is going to be D as in dog. So hourly rounding includes the 4 Ps. This is what I want you to think about. When you go in and you check on your patients, it's pain, potty, do they have to use the bathroom, their position, and then their possessions. Do they have everything they need in front of them? And that's how you're going to improve safety and comfort. So 4 Ps, pain, potty, position, and possessions. 34. At the end of a shift, what should the CNA do with the INO sheet? That's the intake and output sheet. What do you do with it? Do you want to do A? Do you want to put it in your bag and bring it back for the next shift? Is it B, file it in the nursing supervisor's drawer? Is it C, record the totals and document? Or is it D, leave it blank if it wasn't completed? And you got busy, you didn't do your totals. You're just going to leave everything blank. Absolutely not. We're not going to do D. We're going to do C. We have to record it. You wrote down everything your patient drank, everything they ate, if they went to the bathroom, you wrote all that stuff. And now I need you to input it. You have to put it into a computer. So accurate documentation of fluid intake and output is essential for evaluating the patient health. And so what happens is at the end of a 24-hour period, we actually can look at the chart and we can tell if our patient is retaining fluids or if they are producing or not getting enough fluids. And so if they're not getting enough fluids, that means they're going to be dehydrated. So if they have more going out than coming in, they're going to be dehydrated. Maybe the physician needs to order IV fluids, or we need to encourage more fluid intake. But so what you do is so vital, and you don't sometimes realize how the entire team looks at the documentation that you enter into a system, and how that documentation helps to scope or helps the plan of care that we actually create for the patient. So thank you for being conscious caregivers and doing such a wonderful job. Question 35, true or false? There will not be any true or false questions on your CNA test, but I needed to break the monotony. So true or false? CNAs are required to participate in bedside report during shift change. Is that true or false? And if me reading these questions to you is helping you, do not forget that when you take your CNA test, put pride to the side. You can actually choose an audio option for your written test, which means the test questions and the answers will be read to you. I need for you to pass your test on the first attempt. So ask for an audio test. Your professors may not even recognize that you need this much assistance. I know you all need this much assistance because of the questions that we get and how many of you all tell us that you pass after watching our videos. And so question 35, the answer is true, 100%. So CNAs often participate in bedside report. You may not be there with the nurse. It could be you doing bedside report with the off-going CNA. And so that helps to ensure continuity of care. You share important observations and you receive updates about your assigned patients. Whenever, let's say you didn't have a CNA before you. And so the CNA isn't there to give you a shift report. There wasn't one that showed up. And so in that case, the nurse would lead the report. And so CNAs are expected to be present, listen for relevant care details, and may share input on the patient's condition, especially regarding mobility, behavior, and personal care needs. Participation helps prevent errors and promote teamwork. And I know you all probably don't see this happening in your facility, but we have to communicate. And so the nurse has their role, the CNA has their role. And so if you are getting a report from another CNA, when you get them getting a report, just go and say, hey, Nurse Eunice, Nurse Kimberly, Nurse Thomas, I got report from the offgoing CNA. Is there anything else you want me to know about our assigned patients? And that's how you all work together as a team. Yeah, team. Question 36. During hourly rounds at 10 p.m., a CNA documented a patient who is normally confused and attempts to get out of bed was sleeping comfortably. At 11 p.m., the new CNA finds the patient unresponsive, not breathing, no pulse, and cold to touch. What did the previous CNA most likely fail to do during the 10 p.m. rounds? Was it A, check the patient's pulse using a stethoscope, B, call the nurse for assistance with repositioning, C, pause to observe for chest rise and signs of life, or D, raise the bed rails to prevent the patient from falling? So we're telling you to do hourly rounds, but I think some of you all missed the concept of hourly rounds. Hourly rounds don't tell us if a patient's living. If they're in the bed and they appear to be asleep, they could actually be deceased. So the answer is C. I need you to pause. Not everybody's going to be on a heart monitor. Not everyone's going to be on a pulse ox, so you won't have a monitor in their room. I need you to pause to observe for chest rise and signs of life. So just don't tell me a patient's sleeping. Stay, look, do you see their chest moving? Now you can say they're sleeping. So in this particular instance, the CNA failed to verify that the patient was truly sleeping by checking for visible signs of life, especially in a patient who is typically restless or confused. Baby, if their behaviors change, that's usually not a good sign. If they're always up and out trying to get out of bed and now they're like, really sleepy, could be that their condition has worsened or that the nurse may have given them too much medicine. So it's important to pause and observe for chest movement, warmth. This person was cold, and responsiveness. You don't want to wake them up, but usually if I come in and I make a little bit of sound, a patient will move or something. And so if none of that happens, you are, to follow up. Don't just leave and be like, oh, my patient's asleep. So assuming someone is asleep without confirming can lead to delayed recognition of serious or fatal conditions. And in my 26 years as a nurse, I've had this happen twice, where when I came on, the previous nurse was telling me that the patient was asleep, and the patient was not asleep. They had already passed from cardiac arrest. So I don't want that happening to you. Question 37. A CNA is caring for a patient who is refusing care. What should the CNA do? A, force the patient to comply. B, ignore the patient until they agree. C, respect the refusal and document it appropriately. Or D, remove food and water until care is accepted. If you do D, I will see you on the news. You will be the CNA who's all over the headlines. So you will not do D. You can't force these people to do anything. So it's going to be C. You're going to respect the refusal and document it. So patients have the right to refuse care. It must be respected and noted so the care team is aware. So this is what you do when they refuse. Try to find out their why. If they're not belligerent, they're not threatening you. Miss Eunice, why don't you want your vital signs done? I need to, see what I can do to get this done because your nurse and your doctor needs it. Leave me alone. Get out my room. Well, okay, now it's time for you to leave. Before you document it, you have to let the nurse know. All right, because the nurse is in the room, she's getting medicine, she's doing all other kinds of things. And so you let the nurse know when things are abnormal. And so you don't know if the vital signs are abnormal because she refused to let you perform them. Let your nurse know and then document that the patient refused and whatever other information you want to provide, and that nurse, include their name, was informed. And that you will follow up, that you will go back and reattempt the vital signs in an hour or whatever your policy is at your facility and actually reattempt to do it. Okay. And so hopefully your nurses are awesome. Hopefully they're going to go in there and talk to that patient and get it done. Question 38. You enter a resident's room and find them masturbating. The resident is alert, oriented, and able to respond appropriately. What should you do? A, scold the resident and tell them it's inappropriate behavior. B, immediately report the behavior to the charge nurse as an emergency. C, ignore the behavior and continue providing care. D, provide privacy and return later to complete your task. How dare that patient be in the room pleasuring themselves in your facility? Shame on them. You all, the answer is D. More than likely, you didn't knock. You didn't respect their privacy. So provide privacy and return later when your task, to complete your task. Sexual expression is a natural part of life, even for residents in long-term care facilities. If the resident is coherent and not harming themselves or others, they have the right to privacy. The appropriate action is to preserve dignity by giving the resident privacy and returning later to continue care. Confronting, shaming, or ignoring the behavior without addressing a need for privacy is inappropriate and disrespectful. Knock, wait for them to tell you that you can come into the room. And now if you come into the room and they're masturbating, that's a whole different subject for a whole different day. Tell that person you don't feel comfortable, as it immediately get to safety, notify your nurse. And then the nursing team, and if necessary, security will come in also and speak to that patient. Question 39. What is the main reason for a mechanical lift with a built-in scale? Let me rephrase that. What is the main reason a mechanical lift with a built-in scale is used for bed-bound patients? Is it A, to help the patient exercise while being lifted? B, to replace the need for manual repositioning? C, to weigh the patient safely without requiring them to stand? Or D, to reduce the number of staff needed for care? And I'm so proud of you. Great job, team. It is C, is to weigh the patient safely without requiring them to stand. We got the lift for a reason. This person must be immobile. Maybe they are if they have double amputation, so a bilateral, I can't even think of the term right now. I do apologize. If they have amputated limbs, well, they're not going to be able to stand, but you still have to weigh them. So what we do instead is we'll have a mechanical lift with a built-in scale, and that allows caregivers to accurately weigh bed-bound patients without putting them at risk by asking them to stand or sit up. This also ensures patient safety and accurate measurement, especially when mobility is limited. Some of your fancier beds also have a bed scale inside of the actual bed. If you're using a bed scale, make sure that the bed is flat, that you only have on a standard bedding, which would be one pillow, one cover, etc. Usually before we put the patient in the bed, so upon admission, we would have the standard linens on the bed with the one pillow. We zero out the bed. So now it is once everything's zeroed out, and then you put your patient on top of the bed with the same standard linens, nothing additional, not two blankets, not two pillows. That's how we'll get our patient weight. And so the following day, you come back in the morning, and now the patient has on two blankets and they have two pillows. Remember what the standard bedding is. In order for you to get another accurate rate, you have to lay them flat, remove one of the blankets, remove one of the pillows, and that's how you would, keep track of their weight if they are bedridden. So in your hospitals, we have a bed scale, but in some of your nursing homes, we may actually have to use a mechanical lift with a built-in scale. Question 40. A CNA is asked to assist in collecting a clean catch urine specimen. What step must be done before the patient begins urinating? Is it A, go get a catheter insertion tray from the supply room? B, allow the patient to void into a bedpan? C, hand the patient a cup with no instructions? Or D, clean the perineal area with a towelette? Clean catch urine specimen. What is that? I see we're torn. All right, and so for 40, the answer is D. Yeah, we're going to clean. So this one does not involve a catheter. And so if the patient's able to, you're going to give them the cup with instructions. And usually the cup comes with a small package. It looks like an alcohol pad, but it's not alcohol. A small package that has a towelette. They are to clean themselves first, wiping from front towards back. And then with the clean catch urine, they are to initiate their urine stream, and then they can go ahead and put the cup down and collect the urine. And so sometimes we just don't let them start urinating and then catch it from the very start, because the germs, whatever's left on their urethra, it can actually wash into the cup. So cleaning the area prevents contamination and ensures a proper sample. If your patient's unable to hold the cup, sometimes as a CNA or a nurse, we have to hold that cup for them. So go ahead and glove up and be in there to assist them so that we can get that urine specimen. Question 41. We're preparing the patient for a 12-lead EKG. What should the CNA do before placing electrodes on the chest? Is it A, place all leads before cleaning the skin? B, shave any excess chest hair as needed? C, apply lotion for better conductivity? Or D, have the patient hold the wires in place? You're going to learn so much once you pass your test and you're working in the field. And yes, depending on where you're working, you'll have to learn how to do 12-lead EKGs. So the answer is B. We have to shave any excess hair. Excess hair can interfere with electrode adhesion and cause poor signal quality. 42. A CNA is assigned to monitor a patient on telemetry. That means they're on a heart monitor. Which observation requires immediate action by a CNA? A, the monitor reads leads off. B, slight fluctuations in the heart rate. C, a heart rate of 68 beats per minute. Or D, an irregular but consistent rhythm. Oh, this one's hard. What do you think, team? Excuse me. I know we're all over. We have A, B, C's, and D's. And so for question 42, A, if the leads are off, your patient, maybe they're showering, maybe they left the unit, maybe they went to another department like X-ray. But as a CNA, your job is to figure out what's going on. So leads off means the telemetry monitor is not recording. The CNA should reattach leads to resume monitoring. And for some of the other options that you selected, the heart rate fluctuates, you all. And so at one point it could be 68, and then the next 3 seconds later it's 70. So the heart rate is rare that it just stays consistent. So slight fluctuations are normal. Then a heart rate of 68 beats per minute, that's normal. Remember, the range is for adults is between 60 up to 100 beats per minute. So 68 is normal because it falls within that range. And then an irregular but consistent rhythm, not everyone's rhythm is normal sinus rhythm. Some people have atrial fibrillation, and so that rhythm is consistently inconsistent. It's consistently inconsistent, but it's not like right now it's 70 and then it goes to 30. It's going to be irregular between maybe 65 and 75. So the one that you'd be concerned about would be A, because again, if it's showing that the leads are off, what happened to your patient? Where are they? Go locate them ASAP, or for medical terms, stat. 43. After a patient is pronounced deceased, which of the following is an appropriate CNA responsibility? A, bathe the body and position it flat with a pillow under the head. B, place the patient in a prone position. C, start CPR until the family arrives. D, remove all medical devices immediately. What would be the CNA responsibility once a patient is pronounced as deceased? Yep, you have it. That is part of postmortem care, and we have a video on that also. So the answer is A. Postmortem care includes respectful bathing. It has to be based upon their cultural beliefs. So you talk to your nurse, because if this, sometimes we already know what they're, because we ask them questions upon admission, we have them fill out directives. And so that gives us insight. So based off their cultural beliefs, we'll have to determine how that bath should be done. So that's why postmortem care includes respectful bathing, body positioning, and preparing the patient for family viewing and or transport. If you're in the hospital, you will be transporting the patient usually down to the morgue. If you're in a nursing home, depending on the nursing home you're in, sometimes you may have a morgue, other times the funeral home will come, or, if it needs to be investigated, the paramedics, etc. will come. So, but you need to be preparing that patient for transport wherever they're going to be going to. 44. A CNA must collect a stool specimen for ova and parasites. What should they avoid doing during collection? So let me repeat that. A CNA must collect a stool specimen for ova and parasites. What should they avoid doing during collection? Is it A, use a clean head or bedpan? B, label the specimen correctly? C, use a tongue blade to transfer to the container? Or D, collect stool directly from the toilet bowl? All right, giving you 4 seconds in 3, 2, and 1. Yes, the correct response is going to be D. You do not want to collect a specimen from the toilet. So water and disinfectants in the toilet can contaminate the sample, thus invalidating the test results. And I do have a video that shows you how to collect a stool specimen. Use your phone, open up your camera app, scan the QR code. A link will appear. Click that link, and you can watch our training videos. 45. When providing morning care, a CNA notices that a patient has suddenly become short of breath and pale. What should the CNA do first? A, raise the head of the bed and call the nurse. B, elevate the patient's legs. C, assist the patient into a high Fowler's position and stay with them. Or D, lay the patient flat and cover them with a blanket. Suddenly, short of breath and pale. Signs of hypoxia. Signs of low oxygen. What are you going to do? Yes, it is A. No, it's not C. Yeah, because C didn't mention you calling a nurse. So it is A. You're going to raise the head of the bed, and look, the same button that you're using to elevate the head of the bed, next to that is the nurse button. Or you can reach over the bed and hit that code button. But depending on your facility's policies. So the rationale is when a patient shows signs of respiratory distress, the CNA must act within their scope of practice. Raising the head of the bed helps to ease breathing, and immediately notifying the nurse ensures that a licensed professional can assess and respond to the emergency. CNAs are not allowed to make independent medical decisions, so they must report any changes promptly and follow the nurse's instructions. So you will not leave the room. You will remain with them. But again, C was not the correct response because it did not include you notifying that nurse. 46, on what type of patient is a glucometer typically used? Is it A, a patient with high blood pressure, B, a patient with respiratory disease, C, a patient with diabetes, or D, a patient with arthritis? When would we ask you to use a glucometer? Absolutely. If you said C, a patient with diabetes, you are right. A glucometer is a medical device used to measure blood glucose levels. So when we prick their finger with the lancet and then we get that drop of blood, we put it on the actual, I'm going to call it a stick for now because can't think of the name of it, but that's going to actually allow you to get a measurement, a reading, a blood sugar level. So it is commonly used by patients with diabetes, a condition that affects how the body processes blood sugar. Monitoring glucose levels helps to manage diabetes and prevent complications such as hypoglycemia, which is low sugar within the blood, hypoglycemia, or hyperglycemia, which would be a higher glucose or sugar level within the bloodstream. 47, when providing catheter care, how many inches of catheter tubing should be cleaned from the meatus outward? Say that word with me, meatus. And so from the opening, the external opening outward, how many inches of the catheter tubing should you be cleaning? Is it A, 4 inches, B, 2 inches, C, 6 inches, or D, the entire length? All right, I like this. I'm teaching you all something new. And so the correct response is going to be A, you all. So you want to clean about 4 inches, and that helps prevent bacteria from migrating toward the urinary tract. And of course, we have a video on that also. So use the QR code to watch our video on catheter care on a female resident. I don't have a video, I don't think, on catheter care on a male resident. If that's something you all want me to create, you have to go ahead and put it in the chat. Let me know what you want me to create next. 48. A patient requires a transfer using a mechanical lift. Before lifting the patient, which action must the CNA take? A, place the patient in the sling with their arms crossed. B, lock both the lift and wheelchair wheels. C, ensure the lift is unplugged for safety. Or D, get help before beginning the transfer. Before lifting the patient, what action must the CNA take? Yeah, this one's tricky because it didn't say that we're putting them in a wheelchair. We could be transferring them from the bed to a chair, to their Jerry chair. So you all, the best answer is going to be D. You can't do this by yourself. Mechanical lifts should never be operated by just one person. The CNA must get assistance from another trained staff member before beginning the transfer to ensure the patient's safety and prevent injury to the staff. While locking the wheels and properly placing the slings are important steps, having help is required before any of those actions begin. Safety is always a team effort when using mechanical equipment. 49. While preparing to assist a patient to dangle at the bedside, the CNA notices the patient is dizzy. What is the best response? A. Help them stand to improve circulation. B. Have them lie back down and try again later. C. Apply a gait belt and continue the transfer. Or D. Give them water and ask them to try harder. And patients get dizzy. Sometimes they're on blood pressure medications, they're on pain medications, or they've been just in one position. Their body needs time to adjust. And so, whenever you're trying to get someone to dangle, if you notice that the patient's dizzy, you're going to do B. You're going to have them lie back down and try again later. But I also want you to understand that dizziness is a safety concern. So notify the nurse and check the vital signs. Allowing them time to rest before retrying also helps prevent syncope and falls, but checking that blood pressure, because it doesn't matter how often or how much they rest. If that blood pressure is low, the same thing's going to happen all over again. So vital signs are important whenever a patient complains of dizziness. Question 50. A CNA is asked to assist with a sterile dressing change. What is the appropriate role of the CNA in this task? Is it A, change the dressing using sterile gloves, B, prepare the sterile fill and perform the procedure, C, apply antibiotic ointment to the wound, or D, hand supplies to the nurse using clean technique? That's right, you have to know your role. You are not the nurse, but you do assist the nurse. So are you going to assist by preparing the sterile fill, by applying the antibiotic, or are you going to do exactly what you chose? D. In most of your states, a CNA cannot perform sterile technique. So when you're taking your initial certification exam, you cannot perform sterile technique. You cannot put on sterile gloves. Therefore, you cannot do a sterile wound dressing. Once you're a patient care tech and you're working in the hospital, notice they don't call you a CNA anymore because of what I just said. A CNA can't do sterile techniques. So once you're a patient care tech, a hospital level CNA, they will change your name and change your duties. And then they will sometimes teach you how to do sterile gloving because they need you to be able to insert those urinary drainage catheters. But for right now, you're not a PCT. You're trying to pass your CNA test. And with that being said, the only option would be you handing supplies to the nurse because CNAs can assist but not perform sterile procedures. Handing items using clean technique supports the sterile process. And you all, I'm so proud of you all. You've been here with me for more than an hour. Woo, woo, woo. We did it. And so do you want to pass your CNA test with confidence? Of course you do. And so when you go to, we have two websites. If you go to nurseeunice.com, which is shown on the screen, that's where you get your free downloads. That's where you can get your study guides. If you go to our website, which is fltraining.com, you can register for classes. And so we need you to use both of those in addition to our YouTube channels. And so with our YouTube channels, we have videos coming on every week, but we have to do a variety of videos because our students are diverse. Some of you all need help passing your CNA exams, while others want to pass their phlebotomy, while others want to pass their medication administration examinations. And don't forget our nursing students. And so every video will not be about CNA. So thank you for giving us grace and time to help others pass their test too at Florida Training Academy with Nurse Eunice, where you learn smart, you care better, and there's no better time to start than right now. And you know how we wrap up our videos. Remember that you're doing the right thing by beginning as a CNA because caring CNAs make caring nurses. You're putting in the work right now. And on Tuesday, I had to miss last week. On this Tuesday at 9 p.m. on both of our YouTube channels, whether it's Florida Training or Nurse Eunice. I think it's listed as Eunice Mathis. You all, we're going to have night shift with Nurse Eunice. So come on and join me. I want to hear about your weeks, what's been going on with you. We're just going to have conversation. And then if you have questions, I am there to answer those questions for you. And I appreciate you all. I love you. Have a wonderful weekend. Thank you for watching. Don't forget to like, share, and subscribe. Let your teachers, let your testers, let your friends and your colleagues know about Florida Training Academy, because baby, we are helping you pass those examinations. And bye everybody. Thank you for watching.